Hello, friends. I'm Dr. Jamali, psychiatrist working in the UK. Welcome to my new YouTube channel. It's called Dr. J Official. I'll be, doing videos on various topics, but it would be more around research because that is something which I'm very passionate about, and I would like to share my experience with all of you. This video will be useful for those who are new in research or are interested in research and still, unsure where to begin, how to start. This video is also useful for those who need some research competencies and would like to, get some advice or guidance on how to get those research competencies for their portfolio or for their training. So what I will do is today I will start with a short presentation just to touch upon the basics of research, and then I will share my experience uh, about what is the thought process in my mind when I think of research, because sometimes research is not part of our clinical practice as such, although I feel that it should be. Because the best way as a doctor, as a professional, we learn is by asking questions and trying to find an answer to that. And especially as a medical student, as a doctor, we follow evidence based. So the best way to look for evidence based is by research. So it's not like, sometimes, we are under the impression is that research is only about doing a trial or a proper research project. And, but it's not about that. Sometimes just doing a literature review can answer your question. And that question doesn't necessarily have to be a research question. It could be a clinical related question, a scenario which came in your routine practice, and you just want to find an answer to that. So how is it that you can include this in your routine clinical practice without thinking about research as a separate entity that you have to spend a lot of time on it, and it's hard work. It's why is it that I'm doing, or I'm just doing for the sake of it, to improve my portfolio or to get into the publication ladder so that I can that can improve my job prospects or training prospects, etc. So what I'm trying to establish here is that research should not be considered as a tick box exercise, but as part of your routine clinical practice. So, how I made research as my part of clinical practice, that is what I'm trying to show this time. So, I hope you like this video. So, what I will do is I will start with a presentation. Uh, and I'll make it as brief as possible, and then I will try to share my experience. So, it's about a way of thinking, isn't it? At the end of the day, like the questions you observe, in your clinical practice, like you want to say a particular treatment is not working, and you want to you're following particular guidelines, and that is somewhere you've tried that as well, but it's not working. And now because sometimes in our practice we also use off license treatment, but there has to be some evidence behind that. So how is it that you're going to establish and provide a rationale behind a certain clinical decision? And that is where the research or a basic literature review maybe of some help. And that is where the attempt is to further explore this. And just bear with me for a minute. I'll begin the slideshow. So it's about, again, as I said, it's about making an attempt to explore further and then understand and explain your observations. You've, so you wanted to look at a particular treatment for for a condition, and you read upon it, and you found something very novel. That look, this is something which could be tried, which has being used very sparingly, but let's see whether we can give this a try or not. And then you read upon it and you found that, look, there is a very strong evidence behind this, a relatively strong evidence. So you found that, you got the answer to your question. So explain it, and explain it based on the conclusions, and then that, and how it helps you enhance your clinical practice and knowledge base. So that is what it is all about. So what are those questions which always comes in our mind? That it's about, say, let's take examples which are on the slide. How many patients I see every day? Right. Simple. How many patients? Now, why is this useful? Sometimes it is service related. You want to show, or you want to present this to your managers that, look, these are the number of patients I see, and why is it that we need an extra staff or doctors or nurses? So again, it's about how many patients you see in a day, right? What is the average cost of a service to a patient? Again, this is a service related question. And again, that also helps in improving your service, your clinic, your practice overall. What are the basic health needs in the community? What are the benefits of this program in the community? So, like, say you're starting a clinic, which has never been done before, but this is really useful. How? Because you've observed that in your clinical practice, and this is something which has its benefits, and it is something which should be initiated. What are the most common conditions prevalent among my patients? So again, prevalence. What are the causes of these conditions? Again, we think of, say, let's take up two research methodologies like case control study or cohort study. You're trying to identify the cause to a particular condition. Why do some people have a particular condition whereas others don't? So again, that's about identifying the risk factors. What is the most effective intervention for a particular problem? Again, it's about evidence-based medicine. How do I demonstrate the effectiveness of my service? Again, service related, it could be a quality improvement, it could be audit, it could be the cost effective analysis and cost benefit analysis. But also, you want to see the effectiveness of a particular treatment. How is it that, so say you've thought of something out of the box, something very novel, but there is no strong evidence. So you have a question in mind. Now you want to do a clinical trial on that. So say you want to trial a particular medicine for X, Y, and Z condition. You can potentially do a randomized control trial. You're comparing that medicine with the placebo or the usually prescribed medicine. So that is how you determine the effectiveness of that particular intervention. And how can the service be improved? Again, it's service related. You've started a new clinic and you've seen the benefits and how this has improved the overall service. So these questions include the incidence, prevalence, cost effectiveness, cost benefit, effectiveness of the treatment, effectiveness of the intervention, and identifying the risk factors. So these are the common things you come across, isn't it, in your clinical practice? So what are the common research methodology? So as we all know, it's quantitative, qualitative, and it could be a mix of both. So what is quantitative? How would you approach a quantitative or a qualitative study? So a quantitative study is very structured. Like you got a question in your mind, and now you want to try to find an answer to this question. Uh, but you can put a number to them. So, like say, for example, you want to find a particular treatment. So, say uh, use of varenicline for smoking cessation. Now, when you think of varenicline and you want to see the effectiveness, then you say compare it with the nicotine replacement therapy. Uh, how effective it is. So you're comparing, two medications. So, but you can only compare it when you either, you look at the literature and see how effective these are, whether varenicline or a nicotine replacement therapy are beneficial, or one is more beneficial than another, or the combination is more beneficial. So you're looking at the literature reviews, and then you're trying to arrive at a particular conclusion. So where you're looking at the numbers, you're looking at the trials done in the past, the randomized control trials, or any cross-sectional studies or any open label studies, and you look into that and you try to quantify, say, how effective it is. So that is the quantitative study. Uh, and it is very structured, very systematic, organized, which includes, your recruiting participants, you've started the treatment, you're doing monitoring at regular intervals, monitoring of benefits and side effects. So again, it's very structured. When you think of qualitative is not structure. Qualitative is something you're trying to answer a question which is too open-ended. So say you want to see that uh, why there is a particular stigma for a particular condition. Why is people, so say for example, dementia, for example, why people are reluctant going to memory clinics, for example, because they feel that once they've got dementia, once that is confirmed, they would be labeled, stigmatized, and they would end up in a care home, and that is that fear sometimes. So you want to know that why is this happening, despite a lot of awareness, why people still think, and that is where you do a qualitative study. So in qualitative study, you describe the variation, the situation, and in the issue, the concerns, and that helps to answer the question uh, in a more detailed way. So there are various ways you do qualitative study. Other like by doing a focus group or doing an interview one to one or in groups, and you document everything, and then once you've collected all the interview data, then you try and pick up some themes from that what is the common theme coming from this, and then you try to elaborate further on that. When you think of the sample size, the number of participants required, in quantitative study you need more, whereas in qualitative study maybe say five is enough, 10 participants are enough. Maybe that, but that may not be the case in the quantitative study. So these are the subtle differences. It's about differences. It's about what is it that you want to ask. What what is your research question, and that is how you determine the type of or study you want to do. When you think of the focus of inquiry, so that is very narrow in quantitative study. You're looking at a particular treatment, and then you're comparing it with the placebo or the usual, the routinely used treatment. Uh, and when you think of the qualitative study, it's too broad. Like it anything could come. There could be multiple issues, common factors, and then once, because when you're doing a qualitative study, you're writing everything, whatever is being mentioned to you. It's kind of very descriptive, and then you pick up cues from that. So that is a difference there. The focus of inquiry is very broad in qualitative study. What are some common examples? So, like in quantitative study, you're thinking of prevalence or incidence of a particular disease. You're thinking of the intervention or how effective it is. So then, and there is a lot of the statistical analysis that you draw inference, like what is the odds ratio, the absolute risk, and the numbers needed to treat, how statistically significant it is, what is the p-value, what is the confidence interval. So that is what you check in quantitative studies. In qualitative studies, it's again very descriptive. You try to understand the experiences, the meanings, perceptions, feelings, most importantly, and then you pick up themes from that. Once it is all well described, you've collected, you've done all interviews of the participants, and then you sit and then you look into it and you pick up the common themes. That what is it that which keeps coming up repeatedly among participants, and then you arrive at a particular conclusion towards that. Mixed could be a combination of both, quantitative and qualitative, and we see that quite often. Uh, so, say, for example, you're doing a literature review, and you found that I can share my examples as well. So, uh, you did a cross sectional study, and where you want to see um, a difference in a particular treatment, for example, or prevalence. Um, but whilst you were doing the study, you realized that there is some uh, like discrepancy between the participant attendance, where females are attending more than males. So why is the discrepancy there? So when you identify that, then you tend to explore further. So you've got the numbers first in the quantitative study, that like you've got more female participants than males, and you've sent the invitation to everyone, but you've got more females than males, but you don't know the reason. Now, in order to to identify or find the reason why is that, there were limited male participants, you can do a potential qualitative study. And that's where you do a focus group, you invite male participants, or you do a one-to-one and try to get to the bottom of this, that why is it that they were not too keen to participate. So that's where you include qualitative study there. So what does the research journey look like? So you're formulating a research problem. Like you have identified a question. Once you've identified a question, then you think of a research design. You're trying to formulate a research problem, that you have identified a question, and now you're thinking of which would be an appropriate research methodology, and you're constructing, what I mean by constructing an instrument for data collection is you then look into the inclusion and the exclusion criteria, what would be an appropriate sample size, and then you've written up a research proposal. Then it goes to the ethics. You get the ethics approval, you start collecting the data, then you analyze it, and then you write a research report. So you've identified a particular question, you've gone through, you've done your research, and then you publish it. So that is what it is at the end of the day. But how can you do this? How practical this is? You know, Sometimes we always think that, oh my God, it's a daunting task. You have to write a research proposal, then you have to go through the ethics, which may take time, and then you start the study. it's a long, daunting process. You've collected the data, you've analyzed it. Now you have to write a manuscript, and then you will apply for publication. That will take time because it goes through a series of reviews by the editor, by the reviewer. They will ask you to make some changes, and then it eventually gets published. It's a long, long journey, and sometimes it can be very overwhelming. How am I going to do it? Have I got the time to do this? Have I got the capacity to do this? Have I got the skills to do this? Too many questions. So, but where there is a will, there is a way. You, it sounds daunting, can be overwhelming, but maybe there are ways where you can do this in your own time, and that too in a shorter span of time. And that's where I will give you an examples of my work, which will give you an indication of my journey. What I would suggest is that if you want to, just read up a bit more about the research and methodology and also, I really like this book, A Step-by-Step Guide for Beginners by Ranjit Kumar. It was very useful. So if you've got time, please go through this. You can read up some chapters from this book. It was very useful for me. So let me talk about what I will do is I will put the links to my publication so you can look into it in detail. I will not talk about this in detail now, but whenever you get time, just look into this. Now I've given you three examples here. Let me start with this. So just to give you a brief background about myself, I started my career as a GP. I did my GP training from India, and then I worked as a GP for 3 years. When I was doing my GP practice, I also pursued MSc in cardiovascular rehabilitation. And when I was doing my MSc, um, obviously I got some exposure on cardiovascular psychology, and then when in cardiac rehab they do a lot of talking therapy like CBT and motivational interviewing and all, and that's how I developed interest in psychiatry, and then I switched to psychiatry, and now I'm working as a psychiatrist. Um, my area of specialty in psychiatry is old age psychiatry. So you can also say geriatric psychiatry. So when I was doing my MSc, uh, so I used to, see many patients who had an adverse cardiac event, and and then they obviously that brings in a lot of anxiety and fear, which is understandable, isn't it? But but they undergo their cardiac rehab, and there are phases of cardiac rehab, like phase one, two, three, four. Four is the last phase. That's kind of a maintenance phase where it's been like around 3 to 6 months where somebody has had a heart attack or had a very extensive cardiac surgery. Now, what I noticed at that time that patients have some issues with their memory. Uh, but obviously, when at that time they are very anxious and very depressed because of whatever has happened, that can also impact your cognition. Uh, and also when you've had, say, the coronary artery bypass grafting, such an extensive surgery, you can also get some cognitive issues post surgery. So again, that is not an appropriate time to do that assessment. However, when you think of the risk assessment, the risk factors in of cognitive impairment of dementia, there are too many vascular risk factors like hypertension, diabetes, hypercholesterolemia, atrial fibrillation, MI or stroke. So these are all common risk factors for mainly vascular dementia, but also in Alzheimer's you get, or in a mixed picture. So this was always at the back of my mind that can we pick cognitive impairment early? Because sometimes we've always noticed in our practice that when somebody attends the memory clinic, they've had, a heart attack or stroke years ago, and now they've started to develop some sort of cognitive deficit. But it was maybe is it too late because now people, the family and have started to notice that, but maybe something was building up, right from, let's say a few months or a year or two following the adverse event, vascular event. Is there a way where we can pick this early? And then that was a question in my mind, that is there a way we can screen for any cognitive impairment, or is memory assessment possible in a cardiac rehab setting to pick up any signs of mild cognitive impairment? And that's where I did a pilot cross-sectional study, which was entitled Identification of Cognitive Impairment in Cardiovascular Rehabilitation. So you can go read up on this, and this was published in the BJ Psych Open. But when I did this study, I realized that when people were on statins, so what we did is in the study that patients who are on their phase 4 mostly, it's been a few months now and they are stable, they're mental health wise as well, they're stable enough. We obviously we took the history, and then we also use a cognitive assessment tool, which is called ACE3. So we use either ACE3 or mini ACE, depending on the level of engagement from the participant, sorry. And so what we found is that when you are doing the cognitive assessment, there are 4 domains we look into. What we found out is, although the sample size was very small, it was only it was only 18, but we found that around 10 of those who were on statins showed improved visuospatial scores in their cognitive assessment. Out of those 10, 8 of them had cognitive impairment before the adverse cardiac event. But what happened was that their visuospatial score was better than those who were not on statins. In those 18 participants, we found like around 14 of them showed some sort of cognitive impairment. And out of those 14, 8 were on statins, and they showed a significant, and there was a statistically significant improvement in the visuospatial domain. Now, again, that brought in another question, that there has been a lot of literature around statins increasing the risk of dementia. And here I'm seeing that it shows some improvement. Now, that helped me, this was the foundation for me to do further review on this. Now, I'm not doing a research here. This was a pilot cross-sectional study, which I finished within a year. But then I did not pursue for any other trial. I only did a literature review of. I found statins to show some improvement, only in the statistical improvement, statistically significant improvement in the visuospatial domain. But like overall, statins can potentially increase the risk of dementia. So then I started reading upon this. And then sorry, and then I did a literature review on this, which is a preprint publication. I've not submitted this in a peer review journal because I'm still working on this, and that's where the role of preprint publication is. I will talk about the types of publications and all that in my future videos. So watch out for them. Now I did this preprint publication, and when I was working on this, I realized that there is potentially another molecule which I think has a potential. So I was searching for statins, and I found cyclodextrin, which has kind of a neuroprotective effect. So while I did a literature review, I ended up getting another research question, which is this, and this is what I'm planning to do a trial on. So as you can see, what I wanted to establish here is that it's not that I've worked extra hard to find a research question. This was just part of my clinical practice. While I was doing my MSc, when I was in the cardiac rehab, I noticed this, and I thought that, and I did this cross-section study. I noticed this in 2012 or 13, and I did the study in 2019-20. So there was quite a gap. But it's okay. I didn't pursue it seriously. It was only when I found a good platform for me to do this study. So I took that opportunity. But this question was there at the back of my mind. But one question led to another question. So again, I didn't have to really work hard for this. You will see questions around in your clinical practice. It is about trying to find an answer at your own time, and try to develop and improve your knowledge base and skills. Not only around research. Again, research is secondary here, but what this is doing is this is improving your clinical practice. I will give you one last example here. Let me talk about this. So this was identification of biomarkers of vascular dementia. I did this literature review. I started doing this in 2020, I think around February 2022, and it eventually got published in February 2023. Now, how did this question come? So I think by now you all know that I specialize in geriatric old age psychiatry. And when we do memory assessments, there are several types of dementia. The common ones are Alzheimer's, vascular. There is something called mixed dementia, and the common mixed dementia is Alzheimer's and vascular. And the reason sometimes we give this diagnosis of mixed dementia is because there is an overlap of the symptoms of vascular and Alzheimer's. And that's where the question came in my mind, that does it have to be mixed? Or is there a way we can find specific biomarkers only for vascular dementia? Because the risk factors are common for both. But in vascular dementia, I think when somebody's got an adverse vascular event like stroke or MI, or even atrial fibrillation, they are at a higher risk of vascular dementia if they develop any signs of dementia. But then the other risk factors like hypertension, diabetes, that is common in both. So sometimes these conditions, there is a strong family history also. Like we all know that there can be a family history of hypertension, diabetes, and all that, and there is a high risk of dementia if it's running in the family as well. So how is it that we can clearly differentiate? So when I did the study, a literature review, I found that there were two there were four, biomarkers. If they are raised, uh, that indicates more of vascular dementia. So, like for example, high levels of thyroid stimulating hormone, high levels of lipoprotein A, high levels of homocysteine, and high levels of N-terminal somatostatin. So, when I did a literature review, I found these four, indicators to be on the higher side compared to other types of dementia. So again, I try to answer a question where I wanted to see, are there any particular biomarkers which can potentially indicate towards more vascular than mixed? Because when we think of different types of dementia, the management varies as well. So that is where, again, this was a question which came to my mind. And the way I answered this is by doing a literature review. I didn't do any trial on this. I did a literature review. We're just going through the literature, the evidence in the past, and trying to collate all that information and then sharing it. I will talk about that in my future videos about preprint, e-letters, literature reviews, and how can that help you in answering your questions, your clinical questions. You can answer those clinical questions by doing research. So I'll stop sharing now. So this was just the start of the videos which I will do in future. I tried in this video. I tried to talk about uh, some basics of research, and research is not a separate entity or a chapter in a doctor's life. No, it is part of your clinical practice. It is about identifying those questions and trying to find an answer to that. And research could be a best way to try and find an answer to that question. I hope this video was helpful. Please feel free to add your comments, and please do, subscribe. And if you like this, please, like this video and share this as well. And I will, I'll come with more videos related to research and other clinically related topics, or training related topics. Uh, if you've got any suggestions, please, or feedback, please feel free to add in the comment box. And thank you very much for listening and looking and watching this video right from the beginning till the end. And I'll see you soon. Thank you. Bye bye.